Good morning, everyone, and good afternoon for those who are in different regions. The topic that I'm about to speak today is role of image processing in dentistry, a systematic review. Um, which one is abstract? Image processing plays a very important role in many industries. One of those industries is dentistry. Image processing is always a great help in all dentists and clinicians for detecting and diagnosing any disease. To identify the appropriate treatment, the dental image must have been a better contrast of all features. Usually, a dental image process is a tedious process and also a time-dragging process because normally human teeth are not even and non-structures. Moreover, the X-ray images vary due to noise, intensity, and contrast, leading to more challenges in employing image processing. A dental X-ray is always a pre-process to give a good contrast image. To evaluate a dental disease, segmentation of image plays a very vital role. This paper reviews the image processing techniques and its features along with their applications and gives a comparative study about how the techniques are used. The keywords are image processing, X-rays, dentistry, applications of image processing, and dental image processing. Introduction is the general definition of this image processing is the method to perform operations on an image in order to get the enhanced image or to extract the useful information from it. This was first developed in 1960s at Bell Laboratories. The main aim of image processing is to enhance or to improve an image. These days, dental radiographs can be taken from outside or inside, that is intraoral or extraoral, which helps to detect and diagnose, treat, monitor the problem for the future use. Image processing has evolved with time, and now adaptive methods based on AML are more predominant. There are many scenarios in which image processing is predominant. In dental, by using X-ray detection along with image processing techniques can identify the exact location of cavity. It also helps us in finding the impacted teeth or damaged teeth to analyze to develop the growing teeth, jaw movement, and also the facial bones that are more interconnected. In this work, a strategy is provided for choosing a detection algorithm that is more superior to all the other methods. And the rest of the paper portrays different methods of image processing in section 3, and it describes the various methods of segmentation, and 4 concludes the paper. Methods of image processing. X-rays are most common diagnostic treatment in image processing medical industry. Different techniques of dental image processing are used on an input radiographs during the pre-processing phase. That's when we take the image and detect it. Because of the presence of different forms of electronic noise and X-ray being statistical nature, the hospital radiographs obtain lack contrast and have embedded noise. Because of this, generally radiographs are pre-processed prior to the analysis. All medical imaging applications need image processing before moving on to more complex like segmentation and classification. Image acquisition is a step of acquiring an object of an image. Dental image acquisition involves detecting the X-rays using the digital detectors or geometrical setup to generate a digital radiogram. There are various X-ray imaging techniques available such as computed tomography, CT, and magnetic resonance imaging, MRI, and ultrasound imaging. Each of which has own benefits and drawbacks, so it is necessary to choose the right one for a particular application. Image resizing. Digital radiography is a conversion of an analog image into a digital form or acquiring a digital image. It usually requires 2 stages, acquisition and resizing. The goal of this is to create a high resolution, non-interpolated radiogram, and that will be suitable for subsequent pre-processing steps. However, due to their large size and high resolution, pre-processing time for applications such as segmentation and classification are high. This necessitates the use to resize it appropriately so that it reduces the time of computation. Noise removal. Medical imaging, including dental radiographs, is often plugged by image noise. There are several forms of image noise like grainy texture, specular reflectivity, opaque background, etc. Grainy texture is the most commonly seen type of noise classified by a blurry appearance and the jagged edges. This noise occurs when new pixels are added to an image without removing the existing one. Specular reflectivity and opaque background can also contribute to noise in dental radiographs. These noise can be in certain area of an image stand out and appear different from the surrounding levels. Opaque backgrounds can be removed using the techniques like edge detection or CNN conventional neural network, while specular reflectivity can be reduced by blurring the image. There are also several specific types of noise seen in the dental radiographs, including Poisson noise, salt and pepper noise, speckle noise, etc. Poisson noise is caused by scattering of X-rays over the receptor surface, where salt and pepper noise from high contrast pixels scattered throughout the image. Spectral noise is a type of a granular noise that results from a random interference patterns in an image. To remove these types of noise, various algorithm techniques can be employed. For example, this Poisson noise can be reduced through a noise reduction algorithm, while salt and pepper can be removed by applying the median filtering and morphological processing. The specific approach used to remove the noise in the dental radiographs will depend on the types of noise and the desired output of an image. Mostly used one is the Poisson noise. When we compared with salt and pepper, the first one is used mostly. Image enhancement as a crucial action in many image processing applications is a radiograph enhancement. The variety of an image enhancement techniques are used to increase the quality of the input radiograph. Is an image. Radiograph is an image. The method of image enhancement may be defined as a process of making a radiographic feature more distinct. After this process, the results of the improved radiograph that functions better segmentation and automatic detection process. There are two major categories of this radiograph enhancement methods, namely those that operate in a spatial domain and those operate in a frequency domain. When working in a radiograph of the spatial domain, operations are done on the individual pixels. Frequency domain will first calculate an image Fourier transformation and then apply the filter to the result, and then lastly inverse Fourier to get the improved version. One potential drawback of this histogram equalization is that it might enhance the contrast of the background noise, leading to the weaker usable signal. Since it works overall contrast of the radiographs. As a result, AHE, adaptive histogram, is implemented through widely locally scaled window sizes with the result that local rather than global contrast emphasized. Techniques mostly used the methods used in segmentation. Okay, now so far what we have seen is after taking the image, what do you do? Now, how we segment the image? There are many techniques like threshold techniques, texture-based, region, etc. These threshold techniques that is a simple but effective way of identifying the objects and boundary of an image. It involves choosing the value for the threshold parameter, which determines how much the contrast of an image boundary have to be detected. Objects that fall below the threshold are considered to be the objects and excluded for further analysis. By default, the algorithm uses a fixed threshold value, but it can also accept the user in terms of values for both sensitivity and specificity. By applying a threshold to a grayscale image or an X-ray, it is possible to get the binary representation of the original. Space regions or radiograph features form the basis of this method. When it comes to segmenting an images, threshold is a basic operation because after this, doctors can come to the conclusion of what the patient is going through and how the treatment can be taken forward. First, a global threshold is set to all zones. This means that no objects will be considered if they fall below this value. If there are no objects in any particular region, then the second threshold, T1, will be set as a global value and processing and will terminate at that point. However, if the image falls below T0 but not T1, it will be considered as pixel belonging to that zone and processed accordingly. This process is repeated until we get the final image. At this point, that zone's threshold will be used instead of T0 for future processing operations. Multi-stage adaptive thresholding. MAT is the most commonly used thresholding pictures as it follows. Pre-processing number one. Number two, it is necessary to establish two global thresholds, T0 and T1. Each image is segmented into different zones and specific areas. T0 is computed each zone and it identifies the smallest object within that zone. If there are no objects in the specific region, T1 will be set as a global threshold value. If the object falls below the second global T1, then it will be considered as the other pixel belonging to that zone. We should keep in mind if there are several small objects within the same zone, the one should fall below T1, that will be considered as the object pixel. An image has a 1 on its label, whereas the backdrop has 0. The threshold function is defined as a present threshold T and it calculated accordingly. Next one is the texture-based segmentation. Texture-based segmentation is a very important process in dentistry because it allows the dentist to more accurately diagnose and treat the dental problems. By understanding how the textures are mapped onto the specific anatomical features, the dentist can improve their diagnostic skills by better noticing the subtle changes in surface textures. Automatically, texture images can be used on an accurate map of tooth anatomy for 3D printing or surgical planning. Furthermore, textural analysis can be used to differentiate between healthy and the damaged teeth. For example, areas of high tooth surface texture may indicate that the tooth is in good condition, while other areas with low surface texture may be indicative of a decay or other damage. There are various ways that the textures can be captured and analyzed. The most common method is to take a photo of inside surfaces of teeth using a dental camera or scanning a laser scanner. This will allow the high resolution images which can be processed easily into a textured maps. Alternatively, photos taken from outside the mouth can also be used if they contain specific detail about the outside tooth surface. Region-based segmentation. The marker-controlled watershed transform is used to segment regions. Due to its capacity to generate the full partition of the radiograph, this approach has found extensively usage of the medical image processing. Originating in the radiography, the region-based idea draws the line that established where a single drop will land inside a certain area. Grayscale radiographs are referred to as topographic relief in the field of mathematical morphology. Like if I is a radiograph, then the intensity pixel represents the evaluation at that point using this topographic representation. Operating the region-based transformation independently causes the over-segmenting issue. It is necessary to generate this marker radiographs in order to keep an eye on the transformation procedure before acquiring useful partitioning objects. Each link marker is located inside the area of interest and the radiograph is presented as a binary with two possible states. Edge-based detection. Textual analysis can be used to identify different types of issue and organ in an image. This is particularly used when identifying the abnormalities of the disease within the mouth, as it allows more accurate diagnosis. One example of how textual analysis can be used in dentistry is during identification of tumors. By comparing images from different angles and depth, dentists may be able to detect the suspicious area of a patient's oral cavity that could potentially harbor a cancerous tumor. Additionally, a textual analysis can help to determine the stages of cancerous cells by observing the characters such as density and shape. Another area where the textual analysis can be used by accessing the tooth decay. By studying the differences in density and the other across different areas of tooth, dentists may be able to determine whether or not it is affected by decay. Additionally, forensic dental investigation often uses textual analysis to help identify the victim who had the teeth removed illegally. By comparison with images from and after the treatment, forensic investigators can track down the suspects and recover the stolen teeth. Okay, now, small discussion. Cephalometric analysis. These are all the image processing techniques used in this current platform. The dental use of cephalometry is known as cephalometric analysis, an examination of the dental structures of the human skull. Dentists use this regularly in order to treatment the planning. Analysis techniques used in the orthodontics include the Steiner analysis and the Down analysis. The following are some other options available. The link between the bony and the soft tissue landmark is studied under the cephalometric radiography, and resulting analysis may use to detect the phase growth anomalies before treatment and after treatment to track down the properties. Radiograph of a skull are called cephalometric radiographs when they are obtained from the cephalometer, which is cephalopad, that is a device developed in the United States. The craniofacial images captured on the radiographic films may be compared and evaluated using the cephalometer. Forensic applications. There are many uses in this technology like image and the video fingerprinting, water landmarking, filtering, estimation of a location, and its identification. As stated before, technically depends on the situation. One can choose a type of applications like manual review or watermarking, etc. So this is commonly used in the dead bodies after the approval of government. Lesion detection. Caries is a chronic disease. Usually when it is detected in the early stage, it is easily cured. As per the survey, 60 to 90 children are affected and 100% of adults are affected. First, it was reported since 1965, and it is a practice for more than 50 years now. Only with a naked eye, few of the lesions can be detected by dentists, but few can be detected only using the X-rays. Since the depth of these lesion findings is under the top, one can easily find the X-rays for many methods, but it is usually a failure when it comes to the teeth broken findings. Many algorithms are onto this field to diagnose the actual accuracy. Few algorithms have the satisfactory results, but few are better. And the lesion detection is one algorithm was 41% and other is more than that. And my paper concludes, uh, provides a review of the need of digital image processing and describes various pre-processing steps and gives a brief description of the requirement of image, resizing, etc., and the type of noise, and the removal has also been presented. Various segmentation techniques like thresholding, texture-based, edge-based, etc., have been analyzed. Application of a dental image processing in the various domains like cephalometric, forensic, lesson detections has also been discussed. And before I move on to this Q&A, for those who read the paper for the first time, they will understand what is this image processing all about and how it is used in dentistry. What are all the techniques used, how it is used. So my paper will give the basic introduction of how the research can be taken forward. So that is all. Thank you so much for the opportunity given.